Lack of health insurance is a problem for several 100,000 Oklahomans, which drives up the cost for everyone else. Many of them earn too much to qualify for assistance and too little to purchase a health care plan on their own. Oklahoma Watch has been examining the issue, and I spoke with Oklahoma Watch reporter Warren Vieth about what he has found. Warren, we've seen numbers pushing 700,000 uninsured in Oklahoma. About how many uninsured are there?
600 to 700,000, which is roughly a fourth of the working age population.
Who are these people?
They're primarily people who work at employers or for employers who don't offer insurance, or these are people who are working part-time and are not eligible for insurance, or in some cases perhaps they just feel they can't afford it, and in some cases they don't work.
You say they are working.
70% of Oklahoma's uninsured population works either part-time or full-time.
That seems to run counter to some of the perceptions.
Yeah, about a month or so ago, one of Oklahoma's legislative leaders spoke to a group and said, the solution to our uninsured problem is not to expand government safety net programs, it is to put these people back to work. That sort of speaks to a very common misperception that these are primarily people who don't work. In most cases, they do.
You have met some people around the state in your reporting for Oklahoma Watch that have told you about their problems. Do you have some examples or a couple that you could share with us?
I went over to Shawnee and Tecumseh in Pottawatomie County, which is Governor Fallon's home county, and I went to a free clinic there that helps some of these people who don't qualify for government assistance yet are very poor. One of them was a sweet 51-year-old woman, lives in the country outside of Pink in Pottawatomie County. She was working last year part-time, $7.50 an hour for a fast food franchise, had a heart attack on the job, was rushed to the hospital, $36,000 hospital bill. She is now on a combination of medications, including insulin, that costs somewhere in the neighborhood of $1,000 a month. She goes to this free clinic in order to get prescription refills. She couldn't afford them otherwise.
And you met an interesting lady who runs a free clinic.
There is a wonderful 85-year-old woman in Shawnee named Dorothea Copeland who organizes this free clinic, which operates entirely on donated money. She recruits doctors and nurses and pharmacists to come in and provide free care. I went there, I interviewed her, and was about to leave when somebody else there said, "Did Dorothea tell you who she's related to?" And I said, "No." And she said, "She's the governor's aunt." And sure enough, she's Mary Fallon's aunt, Dorothea, which I did not know walking into the place. But
the governor has refused to take federal funds under the Affordable Care Act to expand Medicaid. Some governors now are accepting those funds. That's about 200,000 people that would get insurance that would not, because the Medicaid expansion is not going to happen in Oklahoma. What happens with those people?
Well, they'll continue to do what they've been doing up until now. They'll scramble to get health care when they can get it, or they'll do without it. Some of them go to emergency rooms when their conditions become acute. Some of them find free clinics like the one in Shawnee. Some of them can go to community health centers, which have a sliding scale fee down to as little as $25 a week. But they fall into this coverage crater. We've got a safety net, but it's got some big holes in it, and they unfortunately fall through those holes.
Warren Vieth from Oklahoma Watch, thank you.
You bet.